Hello, welcome to Legislative Report. I'm State Representative Kate Harper of the 61st Legislative District in Montgomery County, Pennsylvania. Today, I'm in the district at Schwenkfeld Manor, and I'm talking to two RSVP volunteers who do APPRISE counseling. What is APPRISE counseling? Well, we're going to find out, but if you have a question about your own or a loved one's health care choices, these are the folks who can help you with that. So let's talk to my guests. I have Amy Kokolas and Bill McLean.
Hi.
Nice to see you.
Good to see you too.
Well, first thing I like to do is to tell my viewers a little bit about the people who I'm talking to. So Amy, why don't you go first? Where do you live? How'd you get here? What's going on?
I actually live in Plymouth Meeting with my husband, John, and my dog, Bear. I'm a stay-at-home dog mommy. I went to Bishop Kenrick High School, graduated, and went to Monco. I got a great education from Montgomery County Community College. Received my associate's degree from there and transferred to Chestnut Hill College, where I received my bachelor's of science degree in business communications. I got to be an APPRISE volunteer Medicare counselor through SCORE, which also is at Montgomery County Community College. It's an agency that helps people if they want to start their own business or such, and they recommended that I maybe go to volunteer with APPRISE because I want to be an advocate for the elderly. And APPRISE allows me to do that and help the elderly with all kinds of Medicare problems and questions.
Okay, so as an APPRISE counselor, you're actually a volunteer. You give advice as a volunteer.
Absolutely. We're not paid one penny. We actually volunteer through a program through the State Health Insurance Program of Pennsylvania, who has APPRISE counseling sites all over Montgomery County. And we just do this because we love to help people, and we have some information we like to give out to people.
And so it doesn't cost anything for a person to get your services?
Absolutely, 100% free. If they're charging you, they're not APPRISE.
Okay. Now, how about you, Bill? Where have you been? I know you used to work at Unisys. We talked about that.
That's true. Well, I was originally born and raised in Pittsburgh, and it bounced around the Northeast, but I've been here in Bluebell for 27 years, and we are going to stay here. We like it here. Enjoy the environment. But I worked for Unisys. I had responsibility program management for mainframe computers, among other things, and was with them for quite some time. Got my undergraduate degree in Purdue in computer science and industrial management. Got an MBA at Canisius, and went to work right after that, and have been doing it ever since. And I've been volunteering with APPRISE for the last couple of years, and like Amy, we're there to help people in a very complex area, which is Medicare insurance. And we know that people need the help. We've encountered lots of challenges and issues, and we're here to make sure that they get the right kind of support without any fees or any forms of charge. And we think that this is a useful benefit that the state of Pennsylvania ultimately provides, and supports for the people not only who are elderly, but also those who require support for disabilities or for other reasons, or in some cases, as we discussed before, children trying to take care of their parents and are faced with these challenges as well.
Okay, now I know that you were highly trained with your college education and for what you had to do at Unisys, but do you get training to be APPRISE counselors, Bill?
Absolutely. We go through online training initially, and it's pretty extensive. And then we have a multi-day course that's trained by APPRISE professionals, and basically that it's the same kind of training if you were an insurance agent, except for the selling part of it, that you would go through so that you understood the different aspects of Medicare and Medicare supplements, how they work, and why you need to evaluate them in a more complete fashion.
Okay, and you, Amy, what training did you go through to become an APPRISE counselor?
The same thing, online training. We had several tests we had to take before we could go ahead and do the in-person training, and that was several days. We also have, usually twice a year, we have regional updates, and for everybody in the area. Donna, our director, also gives out our Monday newsletters to make sure we're up on everything. We also have access to a SHIP hotline to call if we have additional questions. we need clarity or clarification on something, we just have ongoing training. We do National Council on Aging. We can access their website anytime we like. A lot of times we use Google, and we Google information because there's such a vast amount of information out there that we need to bring it in and use it since it's out there.
Well, and that's probably why the program is both popular and necessary. So we're at Schwenkfeld Manor. What's your typical client like, or your typical experience if somebody you set up a little table and somebody come talk to you? How's that work, Bill?
Well, there's a variety of approaches. The first thing we normally do is we put on seminars. And we can do them at places like here, Schwenkfeld. There's enough room here to do a seminar. We can do it if someone called us from a business and wanted us to come in and deliver a presentation to their business, happy to do that. But we normally start with that, and that will raise a lot of questions in people's minds. And that's when we get into the individual counseling. We will do one-on-one counseling. We'll do it face-to-face. We can do it over the phone. But the people who come in are people who have questions because they're turning 65, and they need to understand what their options are and how they choose the right approach. They're people who are elderly and have Medicare coverage right now, but they feel they're paying too high a premium, or their coverage doesn't touch upon certain areas that they require, and they need to find something that does. We run into people that are very low income and need help with either Pennsylvania or federal government sponsored programs to provide support for prescriptions or for payment of their premiums, or potentially getting on Medicaid, which covers everything. So we get all those different kinds of people coming in and have to find ways to support each and every one of them.
All right, now I think in general, healthcare and health insurance has become very confusing.
Yes.
In Pennsylvania still, and in Montgomery County particularly, most people who work on a job or for an employer have employer-paid insurance, at least in part. In fact, maybe 90% of it's paid by their employer. So when they get to be 65 and they're retired, they actually have had no experience in selecting an insurance carrier to take care of them. Is that about right?
Yes, and that's why we suggest in all our literature is that if you're getting ready to retire, if you know somebody's getting ready to retire, give us a call. We would love to help you. It's amazing how confusing it can be until you actually have somebody simply break it down for you. But the most important thing is you need to make sure that you get enrolled prior to leaving your employment. At least get an idea of what you should be enrolling in, what you should be looking at. You don't want to be left out there with no insurance from your employer or previous employer and not enrolled in Medicare in enough time, because then you have a penalty, and you'll have that penalty your entire life.
Really?
Yes.
Okay, well, let's talk about that a little bit, because I guess younger people tend to think, when I'm no longer working and my employer paid insurance is no longer available, I'll just sign up for Medicare. That's not how it works?
No, we suggest if you're turning 65 and or getting ready to retire, basically 65, you have a 7-month window. You have 3 months before you turn 65, the month of your 65th birthday, and 3 months after to enroll in a plan. And we really try to stress that a lot, because people think, I'll wait till I'm 66, 67, and that's when I get access to their penalty. The government wants you to make sure you have insurance. And that's, the purpose of having us, to help you figure out what to do as far as when you get ready to retire.
Well, Bill, why would the government penalize you if you didn't use a benefit that was available to you? It seems like that would be a good thing.
Well, it does sound like it would be a good thing, but basically the cost has to be spread across many different people. And if you're not paying the basic Medicare fees, then even if you aren't receiving any services, then it isn't equitable, and you do have to figure out how to cover the overall costs of Medicare itself. But you can continue, if you continue to work past 65, which an awful lot of people do these days.
Absolutely.
If you work longer than that, You don't have to get on Medicare until
coverage.
you retire and don't have employer-sponsored coverage.
Okay, so I had a law partner who worked into his 80s. So he wouldn't even have to sign up for it, and he wouldn't get a penalty until he actually stopped working at the law firm.
That is correct, yes.
Okay. Well, what about medications and prescriptions? Now, I have to say, healthcare has changed as well. Right now, people get prescriptions to avoid getting things or to maintain certain healthy benefits. And in the past, health insurance plans never even cover prescriptions. Is that part of the coverage?
Yes, it is. There are 4 parts to Medicare. There's Part A, B, and D. A and B, A covers.
Wait, what happened to C?
Well, we'll come back to that.
Yeah, we get back to that.
A covers your hospitals and that kind of function, medical function. B is more of your doctors and the associated support that they provide. D is prescription drugs.
Okay.
So it's a separate part. Now C, there are a lot of different ways you can take Medicare. As Amy said before, you can take original Medicare, which basically has a full coverage, but you pay a much larger percentage as a copay. But there are Medigap plans which allow you to make one payment, and basically you have very little, if any, copays for anything you do, depending upon which of the policies you select. Part C is what's called Medicare Advantage. And Medicare Advantage, you sign up with Medicare Advantage, and it takes the payments the government makes for Medicare and gives you basically a full insurance policy so that you have coverage for the doctor, the hospital,
And the
ambulance, whatever it
prescriptions.
happens. And in most cases, prescriptions as well, it's included in there. The challenge, and that's what's called Part C, the challenge is that there are dozens and dozens of different policies. They have different premiums, and they offer different options. They cover different parts. And what we do, we have tools that help us to go through each one of those plans based on the individual and assess what the cost would be for the individual for each of the plans that they're interested in, so they make a more informed decision. If they have very high prescription costs, as an example, one plan that may actually have a higher premium could have a lower total cost because of how they cover prescriptions. But in many cases, there are people that have low prescription costs, don't have much. They would be better served by a plan that has a lower premium and provides them some drug coverage, but doesn't necessarily have everything under the sun covered as part of that particular premium. And you can change that annually.
Okay. So hold that thought, because now we've explained why we need the APPRISE counselors, because it is a very confusing subject. So stay with us. Legislative Report will return in just a moment.
Did you know that the largest mural in the state capitol building in Harrisburg is housed in the chamber of the House of Representatives? In 1908, artist Edwin Austin Abbey painted the mural, which stands over 30 feet high behind the Speaker's rostrum. Titled "The Apotheosis of Pennsylvania," the mural depicts the great people who will forever have a place in the history of Pennsylvania. At the top of the mural sits the genius of state, which symbolizes the Commonwealth as a ruler on a throne. At her feet, standing on the first tier, are explorers and pioneers who played a key part in the early days of the Commonwealth. On the second tier stands colonial and revolutionary leaders who helped to form and create a democratic government. On the left of the mural are important military leaders, and on the right are leaders in science and industry. Some of those who grace the mural are William Penn, founder of Pennsylvania, who served as the first governor and Speaker of the House; Benjamin Franklin, who signed the Declaration of Independence and constitutions of both Pennsylvania and the United States. Now you know.
Welcome back to the Legislative Report. I'm Kate Harper, and my guests today are two volunteers from RSVP who deal with the APPRISE program, which counsels people for free about their health care insurance options. My guests are Bill McLean and Amy Kokolas. Now, Bill, we're talking about you get this when you should be in touch with people like you or when you need to make these decisions. Now, I know seniors and they get these letters that say, wow, you have to make a choice by such and such a date, and if you don't make a choice, terrible things are going to happen to you. It really frightens them. It's very stressful. Okay, so what's that all about? And is that a good time for them to be calling RSVP and asking for an APPRISE counselor?
Oh, absolutely. It is challenging for individuals. We talk about how you sign up when you're 65, assuming that you're retired, and that's one time. But there's something called annual enrollment, annual open enrollment, where you have the opportunity to reevaluate your plan and potentially decide to go with a different one for the next year. And this is very common and it's very sensible because premiums change, different elements of coverage change every year. So in order to entice people to take a look at their insurance policy, they'll start sending mailings out in September, sometimes earlier, and people will be overwhelmed. They see all of this literature and they're not insurance people. They don't really know how to interpret it. So annual enrollment from October through December basically says that you can make a change. If you come in and talk with us, we will have the updated information on plans and we'll have the ability to tell you what's changed and whether one plan now is better than the plan you've got based on cost or other factors, or if the plan that you've got still is very cost effective for you.
Okay, so Amy, I come into you.
Yes.
I got one of these scary letters, and I sit down with you and tell you I have diabetes and some other associated conditions, but other than that, I'm doing pretty well.
Okay.
Does that matter when I pick a health plan?
It does. The first thing you want to do when you come into us, though, is make sure you have your medications, a list of your medications and the dosage that you take.
I take a lot of medications, let's say.
Bring your pill bottles in.
Okay.
Because what we'll do is we'll go onto Medicare.gov and we'll make sure you bring your red, white, and blue card as well, your Medicare card. We'll use the information from your red, white, and blue card to key in a personalized search for you. We'll enter that information in. We'll go to the next page, enter your drug information in. We'll pick you a pharmacy, that you use, and then from there you can pick a plan that you're interested in. If you have several medical conditions, such as diabetes, you may qualify for something called a special needs plan that caters to somebody that has a chronic illness. Or if you prefer, we can just go through, you can look at Medigap plans online with us, or you can look at like an HMO or PPO, and that HMO or PPO is actually considered Plan C of the A, B, Ds, and Cs.
Okay.
So A is original Medicare, hospital, B is doctors, D is prescriptions, and C is all-encompassing. It's just where you worked. If you had HMO, PPO, it's the same thing. You have one card, doctors, hospitals, and the drugs are all covered by one insurance company with that one card.
Okay. Now, in my legislative office, Bill, I most often get calls from middle-aged children who mom gave the notice to and says, what am I supposed to do? I thought I had insurance. And can middle-aged children of anxious parents get help from APPRISE?
Everybody.
We get lots of those. And because in many cases, they're the only ones who can really take the responsibility to evaluate alternatives. So yeah, we encourage people to come in and talk with us about their parents or others that they may be supporting.
Now, you guys aren't salespeople, you're volunteers, so you don't select a specific plan or anything like that. How does that work? Suppose you do this personalized search that Amy's talking about, and that shows what plans are good for the particular type of drugs that the person's on. Bill, what do you do next?
Well, first of all, it's not just drugs. They are a big influencing factor on costs.
Sure.
But in addition, doctors don't necessarily accept all of the plans out there. Hospitals don't necessarily accept all the plans out there. So in addition to evaluating their drug requirements, we have to find out what doctors did they use, their primary and any specialists they require. what hospital they use. There are factors of that nature that also influence the cost. So we go through all of that, and then we will come back with several choices that have different costs potentially. And there also are factors like star ratings. Each one of these plans is rated, independently rated by the government on a star basis. So you may have two plans that are comparable, but one is rated at a 4-star and the other is at 3.5 star.
And what are the stars for?
They're quality of service
Okay.
that are delivered.
People are happy with them if it's a
That's
4-star.
correct. That's correct. Now,
Okay.
you will get people who are on a plan that has 3 stars and they're delighted with their plan. And you'll get people on 4 stars that say, well, it's really not quite meeting my requirements. So it's not an absolute, but it is a measure of people reactions to the plan for the prior year.
Okay. And then you give them a choice and you sign them up, or how does that work?
Well, we can. We can sign them up. We give them options, and they'll make a decision on what plan they want.
You don't choose.
They choose. They have to. We are not in the choosing business.
Okay.
Now, if they say to us, well, how about signing us up right now? We can do that. We will go through the process. We're actually enabling them to go through the process.
You're helping them.
Yes.
That's correct. But we also would recommend that they call the carrier, whoever the insurance company happens to be, tell them what they want, and they will get additional information in the process of signing up that way.
All right. Now, Amy, the question for you that I have is, what if a person is disabled? Can they use the service, or how do you get them help? They need insurance too.
Absolutely. If you're disabled, come on in the exact same way. We'll go through Medicare.gov. We'll see what plan would work the best for you. One thing to keep in mind too, when we're enrolling you or trying to find plans for you, we always call the carrier to make sure that in fact the drug list is up to date and that your doctor in fact accepts the insurance plan. And we also suggest that they call their doctor's office as well to make sure that they'll accept the insurance plan that they're looking into. Because that's a lot of people that come in, they want their doctors, they love their doctors, and they don't want to change. So we want to make sure that we also include that with our research when we're trying to help somebody.
Well, and that's another change in the healthcare field. I think people used to assume their doctor was in the network, whatever it is, and that's not necessarily true anymore, right?
Correct.
And they have to find something else. Now, here in the Philadelphia region, though, we are actually blessed with lots of good hospitals, doctors, and healthcare.
Correct.
Not to mention the whole pharmaceutical industry, which
Yes.
employs lots of folks here. Is that an advantage? Do the plans cover more of this area than they might in some other part of the country?
It's hard to say. I mean, because there are certain insurance companies that will only deal with certain hospitals. So that's something we really have to take into consideration.
It's all on how they've
Insurance-
negotiated
yes,
with
the contracts.
the doctors, the hospitals. If the doctors, hospitals, whatever element you're looking at, comply with their fees, then they're fine. But in some cases, doctors or hospitals are not willing to go at that particular level, and they will not be included in the plan.
Right. Actually, we had in Pennsylvania a brouhaha in Pittsburgh between an insurer and the major hospital in the city over whether they would accept it. It was very, I think, frightening for the people who use that hospital.
Absolutely.
They eventually worked it out. But so when you're looking at a plan, you're looking at what is the person's particular physical situation.
Absolutely.
What drugs are they on if they're on any prescription medications?
Yes.
Who is their doctor, and what hospital are they likely to want to go to? And those two last things may be connected, by the way.
Yes, yes.
And in
very
this
much.
area, I think often are.
Absolutely.
And then you offer them choices, or I think some people have the opinion that selecting a healthcare plan is just picking the cheapest one.
It's not. And actually, when we go onto Medicare.gov and we get a list of the plans, we can actually go further and click on each individual plan, and it gives a more detailed explanation of exactly co-pays for hospitals and doctors and ambulatory services and such. And if somebody seems very interested in that particular plan, that's when we call the insurance company and say, hey, we have a client in the office with us. We're volunteers from APPRISE. We want you to help us help them get clarification on everything. and they're usually very, very helpful with us.
Are they cooperative with you?
They are. We do need to have the client with us in order to verify that, in fact, there is someone there. It's a security issue, a security measure with HIPAA to make sure. But once they give the authorization to the client that it's okay to speak to us as a representative for them, most insurance companies will speak to us. And
Okay.
usually we have them on speakerphone in the office with us so that we can all have a group conversation.
Okay. Now, what else is it important for people to think about? Suppose I'm perfectly healthy. I'm 64, I'm not, but suppose, and I'm not 64 either, but suppose I'm 64, I'm perfectly healthy, and I'm going to retire next year. What would you want to know from me?
That's a really good, question. If you're healthy and you have a family history of being pretty healthy, you probably want to look at Plan C, one of those plans, and you don't necessarily need to come in with a real high price one. So in many cases, people think that paying a real high price is going to give them a lot more, and oftentimes that's not the case. But people who have illnesses that are something that is going to be prolonged, or if they have a family history of illness, then you have to look at additional options. Medigap plans may be appropriate. Medigap typically is more expensive than a Medicare Advantage or Part C plan, but it covers more.
Right.
So we try to go, for new people in particular, we try to go through those kind of questions to help them make a decision.
Okay, Bill, so suppose I sign up, I'm perfectly healthy. 2 years later, I'm no longer perfectly healthy. I don't know what happened, but suddenly I had some episode of something, and now I've got a problem. That's why there's open enrollment.
That's correct. Yeah, you can change the plan at that time, and there's no penalty. You can change it. There are people that change their plans every year, and there's nothing wrong with that.
And it's important to note, too, the October 15th through December 7th is the open enrollment period. Does not take effect till January 1st.
What?
Yeah. So when you go through the open enrollment period from
Okay.
October through December, you pick your plan, you're all happy, does not begin till January 1st. People are under the misconception that I changed it today, I started today. No, it's January 1st.
Of
I
the
changed
next
it.
year.
Of the new year, correct.
Okay, well, that's probably a good place for us to end this conversation. Amy and Bill, thank you very much. You're APPRISE counselors. You know your business, your volunteer business, and I think the information you provide is very helpful. So what we're going to do is put on the screen the contact information so people can get in touch with RSVP or the APPRISE program if they're watching and they or a family member are in this situation. Now, when's that open enrollment period again?
It's October 15th through December 7th.
Okay, so we want to get this information out there in
Yes.
time for people to take advantage of
Absolutely.
that. And are you busy all year round?
We are. I actually volunteer in Norristown, the Aging Adult Services Building, on Thursday mornings, myself, Sue, and Sally, from 9 to 12. You can stop in if you like.
All year
Give us a
round.
call all year round. We'll answer any question you have, and if we can't find the right answer, or if we don't have the right answer, we'll find you the right answer. But don't wait till open enrollment. If you're having a problem, we actually do appeals as well. So if you're having a problem with a bill or an ambulance charge or anything like that, we also can help with appeals.
Great. All right, well, that's all the time we have for Legislative Report. I'm State Representative Kate Harper, and the contact information for my office will also appear on your screen in just a moment. Thanks for watching. Join us again for Legislative Report.